I think there could be several reasons. A couple of years ago, we had a lot of brain drain outside the country, but we also have in the recent past have had internal brain drain. In other words, a lot of people moving out of the public sector into the private sector. And this could be because of several reasons, one of them being dissatisfaction with the area where they are working, lack of equipment, lack of things to use, and consumables, and so on. And then, of course, emoluments could be one of the main problems. But then, of course, you have the general problem of not having enough staff as a whole to cater for the public sector, and especially lack of specialists in various sectors such as pediatric surgery. So working in the public service, probably one of the biggest things is emoluments, giving them better salaries to take home to their families, but also satisfaction. If I'm not satisfied with the equipment that I have, I don't have what to use, it will make me not really want to remain within the system. I want to help a child who needs help, but I can't because I don't have what to use. Then with frustration, I'll move on to perhaps where I can find those sort of facilities. We encounter them almost on a daily basis. It's a question of time. We are looking at how much operating time we have available, how much staff we have who can be put, can work for a particular shift and so on. So that goes to staffing, but then also what to use. If I don't have the consumables, and particularly one of the major problems that we experience is that of blood. We have issues with having blood, getting blood from blood bank, and so we have that decision where we have a child who's got, say, a cancer, and we need to remove it, but we can't remove it because we don't have blood available. Partly it could just be the fact that we don't have easy access to the specific care that one would want to have. If someone is out at a rural setting, to get them into a facility which their sort of care can be provided is a great thing. So distance and all that comes with that would be there. But then, as I said earlier, a well-equipped workforce is another issue that needs address. For us in the pediatric surgical area, we need more surgeons. We need anesthetists to put those children to sleep. We have just about 9 pediatric surgeons in the whole country. We had like 3, 4, 5, 6 years ago, but we've trained up some locally. And then we need anesthetists to help us run the theaters and so on. So that is also a major hindrance to people getting access to healthcare. I can look at your question in 2 ways. One is, does the hospital have financial capacity to provide what is needed in terms of consumables and equipment and so on. But then also we are looking at the patient and the finances that they need to move from wherever they stay to come to the hospital and be able to stay in the hospital for the time that they will be required to receive that treatment. And in both instances, there is some resources, but I think the resources far outstrips what we would want and what the ideal would be. Most of our patients, for instance, will come in and they take 2-3 days to get here, spend all their money. It's practically impossible for them to get back, and social welfare has to come in to help them, even after we've helped them to get back to where they are going. So yes, that would be even one of the barriers in terms of when a diagnosis is made and treatment is prescribed, and you are told that you are going to go so many kilometers to this hospital within Lusaka, in the capital, and you think about the cost, so you take time to get there, and perhaps by the time you get there, the problem has become worse, or you never get there at all, because you don't want to be you don't want to have that inconvenience, or you don't have the money at all to get there, and so on. Then on the other hand, there is the aspect of the institutions. I think they really lack a lot. They lack funding. The government is doing its best, I think, to put in what it can, but we are far below where we should be functioning, both in terms of getting capital sort of equipment, but also just everyday consumables. We are running out every now and again, and there is need for finances, definitely in the health sector. We need more training for pediatric anesthetists. We need more training for pediatric surgeons. So any investment into that area, especially homegrown solutions. We are already training pediatric surgeons and anesthetists locally, but funding into those areas and would help us. Increased numbers to be trained by various entities, government and NGOs like Kids OR would help us a lot looking into the future.